Hi, welcome to my personal blog. I'm Dr. Steve Grinstead. Today I want to talk about a big issue that comes up a lot for me when I'm consulting with programs or when people attend one of my workshops or seminars. And it's, why are all these people abusing their pain medication? You'll see that there's a big increase in prescription drug abuse in this country. I was at a networking event today, and a lot of people were just talking about this and how awful, horrible, terrible it is. And yeah, there is a big problem, and there's also a lot of stigma that's attached to people living with mental health or substance use disorders. And so there's a lot of misunderstanding about it too. But I believe one of the biggest reasons a lot of people end up abusing their medication is because they're not being adequately treated. They're not being diagnosed appropriately in some cases. They're being given the wrong type of medication. It doesn't work, so they want to supplement it. And some people, for example, they find that if they use a little alcohol with their pain pills, it works better. And what they don't realize is how much risk that's putting them at. And I'm not just talking about risk for addiction, although that's one of the problems. It's also health risks and psychosocial risks. Risks to impaired functioning, getting behind the wheel of an automobile and driving, watching children. Now, the other reason I believe people abuse their medication is because they're not educated about all the pros and cons of the medication when they start taking it. They don't have an exit plan developed when they start taking it. The people they're working with aren't closely monitoring them. They're not testing to make sure they're at the right levels. They're not looking, are they using other substances, alcohol and other drugs, in addition to their pain medication. So I believe these are just some of the top reasons people abuse their pain medication. I'm consulting with my Center of Excellence, Valley Forge Medical Center, this morning. And they have a patient in there now that was on 14 OxyContin tablets a day. And that's a lot of medication. And today at the treatment team meeting, his insurance company, it's a workers' comp case, said he is no longer allowed to go to the physician and that they have 2 weeks to get him off the medication. Unfortunately, they're not going to authorize him for any more time than that. So, the problem is that we're not doing this very smartly. When people do get in trouble with the medication, they need to be taught alternative ways. To make sure they don't abuse their medication, they've got to be on the right kind of medication in the first place. I've been one person who's had an experience with a problem with mixing alcohol and pain pills. It's been over 34 years ago, but I can still remember, my thinking was really not the best in the world about this. I thought, it's not a biggie, it's not hurting anybody, I'm able to function, I had a job, I was really doing everything possible. And what I didn't see, how it was hurting me, it was hurting my daughter, and it wasn't a very pretty picture. And it snuck up on me, like it does many of the people I've worked with. So, if you have questions, please feel free to connect. And if you're watching this on YouTube, please go to the link below and check out my blog. I also want to encourage you to check out our freedomfromsufferingnow.com site. It's going to be a lot of information and a lot of resources for people living with mental health, addiction, or chronic pain, or all of the above. All I can say today is onward and upward.